Hello everyone, my name is Brunilda Subashi, lecturer and member of Scientific Research Center in Public Health, Faculty of Health, University of Vlora, Ismail Qemali. My presentation for today is the role of health education in healthy eating habits during the quarantine from COVID-19 pandemic in Albania. Healthy eating. A healthy diet is essential for good health and nutrition. It protects you against many chronic non-communicable diseases such as heart disease, diabetes, and cancer. Eating a variety of foods and consuming less salt, sugars, and saturated and industrially produced trans fats are essential for a healthy diet. The healthy eating plate. 50% of the healthy eating plate should consist on fruits and vegetables. 25% of the plate should consist on whole grains and 25% of the plate consists on healthy proteins. Also, the healthy eating plate should be accompanied by the consumption of liquids such as water, tea or coffee, and healthy oils such as olive and canola oil. Stay active is also important for good health and prevention of chronic diseases. Health education. Health education is the strongest tool we have because through it is possible to build a new positive relationship toward knowledge and food habits and also prevent potential health problems and chronic diseases related to nutrition. Purpose of the study. Purpose of this study is evaluation of the role of health education in Albania through the comparison of healthy eating habits before and after health education. Methodology. This is a comparative effectiveness research conducted in Albania, predominantly in the city of Vlora, during May to July 2020 using the Adult Food Quality and Physical Activity Level Survey, a survey that was distributed through social media and was completed by 545 adult subjects. The first study, Adult Food Quality and Physical Activity Level Survey, was conducted during the period of May 17 to 27. The health education, which was offered from May 20 to June 20 to 345 interested people, included personalized information on some physical parameters such as body mass index, percentage of weight loss, level of risk of malnutrition, basal metabolism, calories needed to maintain current body weight, calories needed to lose weight, calories needed to gain weight, normal weight range, and ideal weight. The health education also included advices on healthy eating and physical activity related to survey questions. The second study, Adult Food Quality and Physical Activity Level Survey Plus, was carried out during the period June 20 to 25. The first survey included questions on socio-demographic data, questions on food quality, and questions on physical activity level. In the second survey, that is the same survey, but a plus has been added. So, in addition to the questions, there is also the health education that was included to the survey with the purpose to educate the new subjects participating in the second study. Results about place of residence. We can see that most of the participants in this study were from the city of Vlora with 55%. In this slide, we have results about gen and age and gender, and we can see that most of participants in the study were women with 75% and age 30 plus or minus 11.4 years old. In this slide, we have results about healthy eating habits. You can see the fruit chart, vegetable chart, and legume chart. Looking at the percentages before and after health education, in the fruit chart, we see an increase in fruit consumption 2 and 3 servings per day. In the vegetable chart, we see an increase in vegetable consumption 1 and 2 servings per day, and in the legumes chart, we see an increase in legumes consumption 2 and 3 servings per week. In this slide, you can see the dairy chart, water chart, milk chart, and soup chart. In the dairy chart, we see an increase in dairy consumption, 1 serving per day. In the water chart, we see an increase in water consumption, 4 or more glasses per day. In the milk chart, we see an increase in milk consumption, 1 to 3, 4 to 6 servings per week, and more than 1 serving per day. In the soup chart, we see an increase in soup consumption, 4 to 6 servings per week, and more than 1 serving per day. In this slide, you can see the breakfast chart, dinner chart, homemade food chart, and number of meal chart. In the breakfast and dinner chart, we see an increase in breakfast and dinner consumption every day. In the homemade food chart, we see an increase in homemade food consumption, 7 or more servings per week. And in the number of meals chart, we see an increase in number of meals consumption, 4 meals and a light snack. In this slide, you can see the fish chart, whole foods chart, meat chart, and egg chart. In the fish chart, we see an increase in fish consumption, 1, 2, and 3 servings per week. In the whole foods chart, we see an increase in whole food consumption, 2 and 3 servings per day. In the meat chart, we see an increase in meat consumption 1 time a week. And in the egg chart, we see an increase in egg consumption 1 and 2 times a week. Summary of results from the comparison of the two studies before and after the health education. It was found that after the health education on healthy diet, the percentages of consumption of all food groups increased, aligning with the objectives of healthy nutrition. Conclusions. As conclusion, we can say that health education on healthy nutrition has had a positive impact on improving knowledge and food habits in the community of Albanian adults for a short period of time. Thank you very much for your attention.